Merit Health is the Rankin County School District's preferred health provider and key sponsor of its nursing program.
The nurses of Rankin County School District have gotten together to make this video to help inform you of some situations you might encounter in your classroom. We would also like to give you some instructions for emergency medications you might have to administer. It's always up to the principal on who they will delegate, but we want you to have all the information you need so that we can provide a healthy and safe environment for students in school. Students and their health issues are identified on PowerSchool. Anytime we enter an allergy or a medical alert, a little red symbol will appear by their name. Please familiarize yourself with the students who have the little red medical symbol out beside their name and their issues. Our goal this year is to make sure every student who has medical issues has an IHP or an individualized health form on file at the school. These are to be located in a file folder or a binder in the office where they're centrally located and everyone has access to them. However, we do not keep these in the QMs because of a HIPAA violation. We won't post any names of students in the classroom or the issues that they encounter. If you need some posters to help with pictures or reminders, that's okay. Just don't include their name. Our goal is to keep the privacy of students and their issues confidential.
Hi, I'm Lauren Baum, and today I would like to share some medication administration reminders with you. Number one, students are not allowed to transport medications to or from school. The only exceptions are EpiPens or inhalers. Parent consent and a physician order must be filed in the office for these, just like any other medication. All medications, including over-the-counter meds, must be checked in at the front office by the parent or guardian. A parent and physician authorization form is required for each medication, one form per medication. All medications, including over-the-counter and prescription drugs, must be locked up in a safe area where there is little student traffic. Schools are not permitted to give any unprescribed medications to any students. This includes over-the-counter meds. Believe it or not, this even includes Tylenol, cleaning wounds with hydrogen peroxide, applying Neosporin, etc. However, petroleum jelly is great for dry skin or chapped lips, peppermints are great for sore throats, ice can be used for bug bites or injuries, and soap and water should be used to clean wounds, then dried and a Band-Aid or dressing applied. Principals will delegate who administers medications to the students, and there will be a separate training video for those delegated individuals.
These are some of the symptoms for children on ADHD medication: decreased appetite, stomach ache or headache, difficulty sleeping, jitteriness, throwing up, or social withdrawal. If you notice these symptoms reoccurring, it could be that their medication or medication dose has changed. This is the treatment for a child with the above symptoms. Drink water, eat a snack or lunch, encourage interaction. Some children take extended release or short-acting medications. Extended release is taken in the morning once a day for most children. Short-acting medication is taken 3 to 4 times a day for most children. This medication is to be taken near the lunchtime hour.
Fever is a symptom of illness and not an actual diagnosis. Fever usually indicates that the body is battling an infection. A child with a fever of 100.4 degrees Fahrenheit or greater needs to be sent home from school until the fever is gone. If a child appears sick with fever, call the parent so they can have a doctor evaluate the child. Fever reducers such as Tylenol or ibuprofen, while effective in lowering temperatures, only mask underlying infection and do not remedy the child's illness. The child needs to be fever-free without the use of fever reducers for 24 hours before allowing him or her to return to school. A child with vomiting with or without diarrhea needs to stay home from school. The child can return to school when the symptoms have stopped and the child can tolerate a regular diet. The child should stay home until he or she has been without vomiting or diarrhea, less than 3 episodes for 24 hours. Once an episode of vomiting or diarrhea has occurred at school, the student should be sent home and may return to school after the above criteria is met.
Head lice are tiny insects that live on the scalps of a human host. Head lice do not transmit disease. They are only transmitted by head-to-head contact. They do not jump or fly. Nits are lice eggs that are laid by an adult and attached to the hair shaft. Nits alone do not constitute a diagnosis of head lice. Live bugs must be present to send a child home from school. Students may not be sent home for nits only. If live bugs are found, parents or guardians should be instructed to contact their doctor or pharmacist for treatment recommendations. After treatment, a student is allowed to return to school if the parent or guardian presents proof of treatment upon return, such as a receipt or empty container. Treatment should be repeated in 7 days.
We're going to now discuss rashes. There are several different that you might encounter in schools. Many rashes will resolve spontaneously and are not a reason alone to keep a child home from school. Any rash associated with symptoms such as trouble breathing, swallowing, fever, or ill appearance should be evaluated by your child's physician. Rashes that are itchy or scaly may be contagious and they should be evaluated by your child's physician. Ringworm is caused by a fungus that grows on the skin. It does not come from a worm. Ringworm is characterized by a round, pink, red rash. It can be raised and it can have rough edges. It can also have a scaly border. As the rash grows outward and gets larger, the infection can spread. The center tends to be clear. If left untreated, it is usually itchy. Students with ringworm should not have to miss school. They should, however, receive treatment for the condition, whether it's topical or by medication taken by mouth. Skin-to-skin contact with others in the classroom can spread the infection. In order to stay at school, ringworm must be covered with a Band-Aid or a dressing or clothing while at school. Scabies is another infection that we might encounter in schools. Scabies is an infestation of the skin by the human itch mite. The most common symptoms of scabies are an intense itching and a pimple-like rash. The mite is spread by direct, prolonged skin-to-skin contact with a person who has scabies. Scabies is treated with the medication a child would receive from their physician. The student may return to school after 24 hours of beginning treatment. Staph is also an infection we have encountered in the schools. Staph is a common germ that lives on the skin and in nasal passages. Staph is treated with antibiotics that are prescribed by a physician. This can be orally or a cream that's used on the skin. The affected area needs to be covered while the student is at school. If the infection occurs around the nose or mouth and it cannot be covered, treatment must have been started within the last 24 hours. Molluscum is a common skin disease that is caused by a virus. This disease is generally mild and should not be a reason for concern or worry. People with this skin disease can cause the bumps to spread to different parts of their body by touching or scratching a bump and then touching another part of the body. This virus can also be spread from person to person. These bumps must be covered with clothing or a Band-Aid while the child is at school to prevent transmission to others. When dealing with nosebleeds in school, it's important to remember not to panic. Just apply pressure to the bridge of the nose firmly for 60 seconds. If you let go and it's still bleeding, apply for another 60 seconds. Remember to have the student hold their head forward, not tilt it back.
We will need to have a seizure plan for each child who has been diagnosed with seizures. This seizure plan will be filled out by a parent or guardian. Some signs and symptoms of seizures are loss of muscle tone, eye switching, rapid blinking, blank staring spells, inappropriate movement of mouth or face, blank expressions, dazed look, involuntary jerking of extremities, or periods of confusion. If you are noticing any of these symptoms, please note the time the symptoms start. If the seizures are reoccurring, stay calm, lower the child to the floor, clear the room of students, clear the area around the child to prevent the child from being injured. Loosen clothing around the neck and cushion the head. Do not hold them down. Do not put anything in their mouth, and roll the child on their left side if possible, because the child may start throwing up during or after the seizure. There are some children that have Diastat ordered for a seizure. You should use Diastat for a seizure lasting 3 to 5 minutes, or a time determined by a physician. There will be a separate video for Diastat administration.
Allergic reactions are caused by food, medications, stings, or other environmental factors. Symptoms may include coughing, sneezing, runny nose, watery eyes, whelps, rash, or a scratchy throat. In some cases, these symptoms progress to anaphylaxis. This is a life-threatening condition that can cause swelling around the nose, lips, eyes, throat, and airways. If the student begins to have difficulty breathing, an EpiPen must be administered. It is prescribed by the student's doctor and provided by the parent to be used for the student at school if the need arises. If an EpiPen is used, 911 must be called and the parent or guardian notified. For teachers who have students with an EpiPen, please familiarize yourself with the separate video regarding how to administer an EpiPen.
Asthma is a two-component disease. This includes airway inflammation and narrowing, airway obstruction by increased mucus production. Symptoms of an asthma attack may include, but are not limited to, cough, a heavy sensation in the child's chest, shortness of breath, wheezing, rapid heartbeat, flushed, moist skin, or a hunched forward position. There are several things that can trigger an asthma attack. These may include upper respiratory infections such as colds, allergens and pollutants, cold air or a rapid change in weather, or some medications. Exercise and activity may also bring on an asthma attack. Stress or emotional upset, along with injuries to airway, may also bring on an asthma attack. Each student with asthma must have a school asthma plan on file that's completed by their physician in the school. Each year, we start over with a brand new plan. Familiarize yourself with the plan and how to act in the event that a student has an attack at school. Key points to remember are never leaving the student while they're having an asthma attack. If they must be sent to the office, please send them with a buddy. Every time a student has an asthma attack, please notify the parents. Despite the common myth, placing a child's head in the freezer or in a cold area is not going to stop an asthma attack. Try to keep the student calm. Encourage them to take slow, deep breaths. We hope this information has been helpful. Please feel free to contact us with any questions you may have.